All right, we'll go ahead and get started now. My name is Casey Horan McGee. I'm the Director of Communications for the Orleans Parish Sheriff's Office. Thank you all for joining us this morning. And we're going to go ahead and first get started by allowing our guests to introduce themselves. We want to first just welcome you all to the Mental Health Awareness Month media briefing hosted by Sheriff Susan Hutson and the Orleans Parish Sheriff's Office. We thank you for joining us for this conversation about why mental health in our prisons and jails across the nation is such a major focus for Orleans Parish Sheriff's Office and our sheriff, and how we are taking a human services approach to the work that we do here. So first, let's go ahead and introduce our speakers, starting with Sheriff Susan Hutson. Please unmute.
Senior moment. Good morning, Sheriff Susan Hutson. Really glad to be on this call and in this seat, trying to work on this really weighted issue for our community and every other community in this country. I ran for sheriff on a platform of using a public health approach to dealing with crime. We know that at any given time in our facilities, over half of the people there are on our mental health docket. They take mental health medication. They have a diagnosis. So we know that that's a big part of what goes on in the jail. And we also know that jail is not the place to treat mental health. And we're doing that because there are not enough facilities in the community to do that. Study after study shows that if you have those resources in the community, you can keep people stabilized on medication, getting treatment, they can live good lives outside of the jail system. That's where we want to get to. And what we want to do is start with those who are in our jail, dealing with them, giving them proper care and treatment. And we're so excited about our new partners in medical and mental health with the Wexford group. And we look forward to talking to them on this call in conjunction with LSU mental health. So that's just a big win for us. And it moves us on the goal to what I told this community I would do. And the community said they want this mental health approach, but there's also a personal part to it. My brother came home from the Navy, PTSD, and he was lost for a while. And there were not resources in our community to really help us to manage it. And I know that if we can come together as a community, we can help families who went through the same thing my family went through. So I'm honored to be a part of that. It is a big part of what I said I would do. And I'm so glad that we're kicking this off now. So thank you all for being partners and for help moving this forward.
Thank you, Sheriff. I'll toss it to Dr. Ashia Bade.
Hi, everyone. I'm Dr. Ashia Bade. I am the Corporate Director of Behavioral Health for Wexford Health Sources. I'm a clinical psychologist by training, and I've been working in corrections for about 12 years. I started my career working as the lead psychologist in a maximum security juvenile facility. I moved into overseeing an entire state's Department of Corrections, and then now I've been overseeing the clinical services and behavioral health for all of our jails across the country. I'm very passionate about mental health and providing good care for patients as much as we can, and I'm very excited for this new partnership with Orleans Parish as well as with LSU. I'm very committed to this cause just on a personal level, and for professional reasons. I think this is where we can make a lot of change, and I hope to be a part of that.
All right, and Dr. Malone and Dr. Williams from Onyx.
Sure. Hello, everyone. My name is Dr. Ayanna Malone, and I'm the Chief Strategy Officer for Onyx Therapy Group. My specialty is the meta awareness and educating people about their own psychological processes. Our team has worked with Sheriff Hutson to create a multi-tiered wellness programs for correction officer staff. And then I will turn it over to my colleague, Dr. Williams, who works most directly with the staff as a wellness coach. Dr. Williams.
Hello, I'm Dr. Victoria Williams. I am here as the lead wellness coach for the Orleans Parish Sheriff Office. I provided by Onyx Therapy Group. So I implement individual and group sessions to address staff struggles and stress, the overwhelmingness, and also some conflict resolution to help enhance the staff's well-being while they work.
Thank you. We also have Mr. Damon Smothers.
Yes, hi, it's Damon Smothers. I'm the clinical program director with OPSO. My background, I'm a school psychologist, a licensed school psychologist by trade. I've had private practices in California and in Florida, and my specialty is areas like violence prevention, emotional intelligence, of course, the conflict resolution, group processes, and making sure we have programming that emulates the mental health side that the sheriff is very adamant about getting this done. It's a wonderful way for us to continue to move this forward in a positive direction.
And we also have from Wexford Health Services, Dr. Michael Mitchell.
Oh, hi, everybody. Yeah, I'm Mike Mitchell. I'm Corporate Medical Director of Addiction Medicine Services. I'm board certified in addiction medicine and very passionate about treating patients with substance use disorders. And I'm here actually today as like a phone a friend, should any complex addiction medicine questions come up. Thank you.
And also joining us is Ms. Wendelin Peckish with Wexford as well.
Good morning, everybody. Part of my role as Vice President of Marketing and Communications for Wexford is to help the public and society understand how important mental health in corrections is. The justice-involved population is often underserved, and by really taking this topic to the public, we can get over the stigma of asking for mental health care and make sure that it gets the attention it deserves so that we can break the cycle and help our people with mental health issues who are justice involved get back out into the community and have a good life moving forward. Thank you.
And I'll start the panel questions with you, Sheriff. Again, you shared a little bit about your platform and why you ran for sheriff. Can you share a little bit more about why mental health is such a critical piece of the work that you're doing here at the Orleans Parish Sheriff's Office?
Yeah, thank you, Casey. We started out talking about, mental health in the jail and the number of people on the mental health docket. But what we know about the entire population of the Orleans Justice Center and the temporary mental health center is that our jail is full of folks who have mental health diagnosis, who have dealt with trauma in their lives and addiction. And so and sometimes all three, right, are a part of the population in the jail. So, you have to treat that accordingly. You treat it as if it is a public health issue. Violence is a public health issue. And if you treat it with that approach, you have experts like the ones we have here who are going to be helping us to work on this issue. And then you put plans in place to help people. We know that they can succeed. So that's what we're trying to do. That's why Mr. Smothers is here. That's why Wexford is here. And then for our own team, who again have vicarious trauma, as Dr. Malone spoken about, is we know that they're living some of this too in the jail. And so we know that to treat folks right and to take good care of them, our warriors in the jail have to be taken care of also. So I see both as being just absolutely critical.
Can you talk a little bit about the new partnership with Wexford and why the shift? There was a previous partnership with another medical provider. Why was Wexford chosen?
Wexford best fit this approach, this public health approach, and we're so grateful that they put in and that they won this. I had sat through the process for the prior provider, which occurred while I was sheriff-elect. I wasn't even in office yet, so I didn't really have a vote or a say in that happening. But I knew we couldn't keep doing the exact same thing we've been doing. We have issues with making sure people get the right treatment, making sure that their concerns are addressed. And that is one of the biggest issues with behavior in the jails, is whether or not you meet people's needs. So, and then that public health approach again, where we're trying to do something bigger than just the jail. We needed a partner who understood that and could come be a part of that. So we're very grateful, very grateful.
So let's talk a little bit to our partners from Wexford. We're excited to have you all coming on, and we've had some very informative discussions in the past few weeks. One thing that was discussed with the leadership team is how mental health and healthcare in a jail and prison setting is kind of a new concept in a way. I wanted Wendelin to kind of touch on that a bit, just the increase of this type of healthcare in a jail setting.
Sure. So mental health is becoming one of the primary focuses across the country of correctional health, prisons and jails. And the reasons behind that are twofold. First of all, budgetary reasons. There are many instances across the United States where more traditional avenues of getting mental health care, such as psychiatric hospitals or mental health clinics in the community, have been shut down because the communities couldn't afford to keep them open. So what that means is people who normally went to those locations now have nowhere else to go. And a very common occurrence is someone, perhaps someone who is bipolar or someone who goes off their meds and has an incident, an isolated incident, loses their temper, breaks a store window. They get arrested. They end up in jail. Did they commit a crime? Sure, technically. Are they a criminal? Do they belong in jail? No. We could much more easily help them if they went to a community health center, but those don't exist anymore. And so they end up in the justice involved population at the local county jail. Another reason, so we are becoming the mental health centers, if you would, jails and prisons across the country, taking the role of former psychiatric hospitals and mental health clinics. Another reason is simply that the stigma of asking for mental health care is wearing off. More people, 10 years ago, it was embarrassing to admit that you had a mental health problem. Not so much so now. And even among incarcerated individuals, people are asking for help. The demand for mental health care is skyrocketing. So supplies are going down, demand is going up. It's getting very hard across the country to find mental health care. Even in the free world, when you try to get an appointment with a psychiatrist or a counselor, it's tough. And it's even tougher in a jail or a prison center. So demand skyrocketing, supplies going down. There's really a need for this niche to fill mental health care for the justice involved population, because we get some very high acuity individuals and they need help. And our role at Wexford Health and with LSU is to make sure that these people get the creative programming that they need. It's for higher acuity individuals. It's customized for a population and an environment like the Orleans Parish Sheriff's Office. And we're very proud to be partnering with LSU, a nationally renowned academic medical center. And I think Dr. Ashia Bidet and her and Dr. Mitchell can talk a little bit more about the specific clinical aspects. But our role at Wexford Health is to partner with these renowned clinicians and develop corrections-specific programming that will help break the cycle of recidivism so these people are getting the help they need and are being enabled to be productive members of our community and not ending up back in the jail over and over again.
Thank you for that. Dr. Bidet, let's turn to you. What are some of the biggest issues or concerns that you're seeing when providing mental health care for justice-involved people?
I think the barriers that we find in the correctional environment are those that have already been mentioned, just the sheer numbers, the number of patients that are coming in with these high level of needs, mental health diagnoses that have gone untreated, people who are off medications, behaving somewhat erratically. And the challenge is kind of reining in the care that we can provide for them and providing in an effective way. One way we're able to do that, Wexford has developed programs that are clinical in nature, that are based on this correctional environment, so that we can effectively manage some of those really specific justice-focused issues. For example, we see a lot of patients who have psychosis. And again, like Wendelin said, there's people who are ending up in this environment because of a behavior that existed outside of corrections and looks like something that might be a crime, but may just be related to a mental health diagnosis.
How is the partnership between Wexford and LSU working together to provide services to OPSO?
Absolutely. So Wexford has been able to provide services across the country in a way that manages and provides care for the individuals in that community. And with LSU being our partner, it's super exciting for us because they have this incredible incredible background in providing mental health care in that community. So that being a partner for us in that area to provide services for OPSO is going to be a strength moving forward. They have certain programs that they have developed on their own, and they want to work in partnership with us and provide to OPSO or at the OJC and the TMH facilities. They've got innovative ideas related to dealing with assessment and diagnosis of individuals with intellectual disabilities, as well as individuals who are facing challenges with psychosis. And I think those kinds of things are things that we can work together as partners with LSU and provide them with world-class care.
You mentioned the word assessment. I know, Sheriff, this is something new under your administration as we're assessing people more fully as they come into our custody. Can you talk about that a bit?
Yeah, so during when I was running for sheriff, our community, many organizations throughout the community, whether criminal justice, medical, mental health, across the board, got together and put together a platform. And part of that platform was making sure that we assess folks, we know the whole person or the biography of the person, if you will. So right now, our current provider screens from, are you taking some type of meds, mental health diagnosis, other types of medical diagnosis, but we don't really look at the whole person. What is going on and what got you here? And that it can be many reasons that people end up in jail. And so now as we sit down and look at assess the whole person, now that Mr. Smothers is here, we have case managers. We just started assessing folks. And Mr. Smothers has only been on board since I think February. So this is a huge leap forward in just a short period of time for us. But we are now assessing the whole person. Is there something that's going on with your family? Is there something going, addiction, mental health, trauma? Is it educational? Do you need job training skills? What do you need? What do you need to enjoy this amazing city that we live in? So very excited about that going forward. And we're actually kicking off some programs this month, and Mr. Smothers can tell us more about that. But just this is why I ran for sheriff. This is why I got in this seat to have a real effect on people's lives.
And that was a beautiful segue because I was going to come to you next, Mr. Smothers. What types of programming are we making available now to the residents, and how's the reaction been so far? I know it's like Sheriff said, it's kind of just starting to unroll, but how's it going?
It's interesting because I have a list of things and I have to keep my time down. But it's just so exciting to see the things that we have, and we've had programs that we have currently, like Girl Scouts Beyond Bars. We're doing that, and that's a really good program with our facility. We're about to add Boy Scouts. Also, really excited about that program. We have faith-based groups that we're dealing with, and we have the Catholics, Baptists, Jehovah's Witnesses. We have Islamic representation. We really have a good group of getting the spiritual side of these individuals, because again, a lot of them feel that all they have in there is themselves and their God. And if they're seeking to find a better connection, we're here to support that. We've had our first baptism this year. We're really excited about that. That was wonderful. So we're looking at continuing that process throughout the years. Hopefully it will never stop. We're talking about Metropolitan Human Services, dealing with the mental health side of counseling with these individuals. We have Goodwill Industries in dealing with advancement and readiness for the reentry. Alcoholics Anonymous, and raise your hand when I'm going too far, because there's a lot of things going on. I don't want to take up too much of the time. Operation Restoration, we're dealing with a math circle. One Book in One New Orleans, Sister Harvard's decarceration program, and Restore. I was really excited because I get a chance to see some of these things in effect, and to watch these young men sit there and talk freely about their trauma, and having us to be able to unpack that is a profound thing, because they want to just be heard. And I really appreciate having this opportunity to move this forward. We're going to be working with reentry mediation is going to be coming in soon. Be More of New Orleans is going to be our program that we're doing to teach barbering. We have a lot of individuals there that cut hair, and they told me, I was in there yesterday in one of the pods, and the guy says, Smothers, you come in here on Tuesday and Thursday, we'll hook you up. So it was just interesting to see how they feel hopefulness. And that's one really good thing that I appreciate about what we're doing with the mental health side. addicted to the lifestyle. It's really getting an entire approach of why the individuals have actually began down this road to unfortunately cause them to be justice involved. But what I'm not hearing when I sit in on these groups are people making excuses. It's really, really, I want to say good to see that from a therapist approach, that they're not passing the blame on someone else. They're taking responsibility for what they've been accused of, and they're trying to make their lives a lot better. So we're really doing some things that I think are going to be cutting edge, and the case managers that I'm supervising are really excited about making this a holistic approach of dealing with the residents in the OJC.
And when you talk about holistic as a complete organization, and the sheriff's mission to really support the wellness of our staff, that's another picture in this mental health conversation, because working inside the jail can be a challenge.
Yes.
And so Onyx Therapy has been on board since last year. So I want to toss it to Dr. Malone and Dr. Williams to talk a little bit about the wellness program that's been put in place and what types of issues are staff really dealing with, and how it impacts them on a day-to-day.
Thank you for pivoting to us, and we can also talk about the mental health of the staff, because we're finding a lot of acute stress disorder. We're finding a lot of secondary trauma that the staff is feeling when having to deal with, some difficult behaviors, extreme behaviors, being responsive to behaviors they might not be used to on a day-to-day basis. Feeling extreme overwhelm is another one. When you think about many of the officers that are working with the residents, they might not be aware of their own personal triggers, of their own personal feelings, of people they may know who are residents within the jail and how that affects their relationship with them. And having our wellness coach there, Dr. Victoria Williams, being able to have different sessions, and I'm about to punt it over to her to talk about that, has been really impactful in us understanding what the staff also needs in terms of their own mental health support, because as we know, it brings up so many other issues that they may have and that they're going to respond to in those situations. So Dr. Williams, would you like to talk about how you coach the staff?
Yes, it's been a very extraordinary experience to see how they navigate their world outside of the jail or their work. I've never been in a situation where you see this really cohesion between their lifestyle and their work life, and just some of the things that we talk about and the way that we have conversations are mostly about balancing the two. Really, I talk more about integration, because there's no true balance in those worlds. A lot of times people come in with the bear, as I say. And so how do you make sure that you don't take the bear inside of your workplace is what we mostly talk about a lot, just kind of like having that integration, really de-stressing. When you're overwhelmed, what do you do? Tactics on like conflict resolution, really understanding what you're experiencing when you come to work is so important. And I'm always surprised about what we talk about. A lot of times they're like, I don't have anything to say, and then they sit down and like, oh, I didn't know that that's what I was actually experiencing, what I was feeling. So it's been a great experience, and they're happy to have me there from what I've heard.
Mm-hmm. And I think the engagement, I think Dr. Williams is being a little bit modest, but the engagement that she does is a really unique approach to mental health. We have a warm line where people can text us, where the staff can text if they need support. And she goes there in person and she walks the floor and literally has these mini individual sessions, wellness check-ins. She goes for day shift as well as night shift. It really impacts the staff in a different way, because many were reticent, to what Ms. Peckish was saying earlier. There's a lot of stigma, when it comes to, I'm feeling this way, I feel stressed, I have trauma, this is what happened to me. especially when they're wearing that uniform and want to project that idea of strength. I've got this. I've got everything under control when really they do not. So when, Dr. Williams goes around and does those little individual check-ins or reminds them, text the warm line and somebody will talk to you. We're finding those tangible and accessible bits and pieces of therapy have been very, very impactful, more impactful than when we try to bring people in for an hour-long session. Like Dr. Williams said, they'll also, oh no, I'm good, right? When really they may not be. So I did want to add that accessibility being a huge part.
I'd actually like to add in here, just real briefly, in my work across the country, I find that this program is so unique and so innovative, and it's so exciting to me to be a partner with an organization that utilizes this service. It honestly speaks a lot to what OPSO is trying to do. It means a lot that this is an area of focus for them. And I'm just excited to be a part of it. It's a real area of interest of me. Secondary trauma for correctional staff impacts every aspect of the facility and every aspect of how the residents function. And so it's really important that I just want to give them credit because it's huge and it's innovative and it's very exciting.
Yeah, that was actually going to be my next point. How does the support for the staff really translate to the impact it has on the residents?
Who would you like to answer?
You can go ahead, Dr. Bidet.
Oh, sure. Okay, yeah, I'm happy to. So the way I see it, most simply stated, healthy staff can help create healthy patients, right? So the staff taking care of themselves, managing their stress and day-to-day functioning will allow them to have more patients, more calm, bring to the facility what we are trying to do all around, which is a safe environment in which patients can function. Residents are able to get the care that they need, again, serve their time, but stay safe the entire time.
I'd like to tag in, that is a excellent point about safety, within the system. When we're talking about conflict resolution, there's conflict resolution amongst the residents that needs to happen, behavior de-escalation, but there's also conflict that also happens between the officers and the residents. And when the officers are in a better place to deal with people, like I said, coming at you with behaviors you might not be used to because they're not mental health professionals, they're correctional officers. So knowing how to de-escalate themselves, knowing how to step back, knowing how to redirect behavior, I'm hoping that over time, you're seeing this de-escalation of violence, whether it is inter-resident violence, whether it's correctional officer to resident violence, or vice versa, right? In terms of, the residents acting out against the correctional officers, being able to focus on them as really key leverage points and keeping the facility safe overall for everyone who works there. It's an excellent point.
Thank you for that. I want to shift gears a bit because the sheriff often talks about dealing with the root causes of crime, addiction, trauma, and mental health. Addiction being that first one. I want to ask Dr. Michael, what are some of the diseases and addictive disorders that you're seeing in a correction setting, and how are you working to establish programming or support for those individuals?
Well, that's a great question. Well, we certainly have a disproportionate share of patients with substance use disorders in a correctional environment. Some polling data shows up to 85% of our patient population has a use disorder. We really can't treat that use disorder without addressing their mental illness, and vice versa, actually, because the two often go hand in hand. So we at Wexford really believe, and we just love the sheriff's openness to treat the patient as a whole. We believe in universal screening. Everybody that comes in, screening them for substance use disorder, and specifically also opioid use disorder, treating the opioid use disorder with medication because it's evidence-based. It shows a decrease in domestic violence, decrease in recidivism, decrease in infectious disease, just so many positive things. I can go on and on. So we're excited to work hand in hand with the department, the mental health department, the physical medicine department, to treat patients for their addictive diseases. I think it's just so important. And so for so many years, we didn't do that. We just brought people in, we put them through withdrawal, often a painful withdrawal too, which now we're trying to do, more of a humanistic approach, or take a humanistic approach to medically supervised withdrawal. and treat all of the patients with addictive illnesses. It's very important. We have to understand that people with addictions have behaviors that they normally would never have, because what happens in a use disorder is literally their reward system takes their cortex of the brain hostage, and they see that as the drug is essential for survival. So we have to help them get through that and help them deal with the consequences and some of the behaviors that they did prior to incarceration.
Yeah, we've had a very robust discussion, but I don't want to occupy all the time. I do want to open it up for questions to the media shortly. But one last thing I want to ask, because we do have media representatives from New Orleans. I know Wexford is pretty new to our city and our agency, but are there any themes yet that are showing up specific to the New Orleans population? Dr. Bidet?
Yeah, I think the theme that we're seeing is just the community is such a positive one. And I say that honestly and like genuinely. New Orleans is like honestly one of my favorite cities in the whole entire world. So I just think the sense of community in that town is so great. How unfortunately some of the issues that exist, including racial disparity, and then also the substance use disorder, and then the crime that exists. So all of those things kind of in conjunction, it's not necessarily unique to New Orleans, but I'm seeing it in a whole different light because of the way, again, I love that town. And I think there's things, the improvements that want to be made. The sheriff's focus on this really demonstrates this is a totally different environment than I've ever worked in. I find it really exciting and very positive.
And with that, I'll ask Sheriff one final question, and I'll open it up to the panel. If there's a signal of success with all of these programs, what does success look like with the implementation of the wellness programs for staff, the programming for residents, the new mental health provider? What does success look like to you?
It looks like a safe working space. It's a safe living space for our residents, and it's reunification of them with their support systems and their family. And our community is working with our providers, with our security staff. It takes a village to do this. You literally need that whole support network. And so when that is all humming together, we're going to see people going home and having secure places to live and having a family to take care of them and having resources. That's what success looks like. And ultimately that they don't come back. And that's what we're trying to do as well. This is a great city to live in, but not when you don't have. So if we can help them to have that rich family life, we're reunifying families. Criminal justice system has taken apart. We're going to put those back together with the help of our providers, with the help of our community. And that's going to be a measure of success when we see them being able to be at home.
Does anyone else want to answer that question? Okay. I will open it up to our media partners who are on the call. If you have any questions, you can go ahead and unmute yourself and we'll address you now. Okay. So I don't see any questions coming through. You just mentioned one thing, Sheriff, that I did want to touch on, the family reunification being a part of this mental health service position. What does that mean when you look at the population we're serving, and how are these providers assisting us in getting there?
Yeah, mental health, addiction, and trauma can tear families apart. Even if you don't go to jail, they can tear you apart. But when you do go to jail and you're taken out of the equation, you're out of the economic success of the family, you're not taking care of your children, all these things are going on, all the burdens are shifted to caregivers at home. That causes all kinds of issues. And even if you're caring for a loved one with mental health or addiction out in the community, that is a difficult prospect for families to do without resources and help and knowledge. I'll go back to our own situation. I have my younger brother was the one with the PTSD from the Navy. I have 3 sisters and another brother to help with that. It was tough for all of us to manage that as a family. And we are a together family. So that's really tough. But it was tough because we didn't have the resources from in the community to do the help that we needed. When we lived in Texas, we didn't have it. When we moved to California, we had it. I want to see that same thing here in New Orleans, where families have that help that they need to give this care. It is really tough to manage an adult or even a child with mental health, addiction, or trauma, or all three together. So, yeah, we want to help. We want to help.
And with the mention of children, we know that 17-year-olds are now coming into our custody and being charged as adults in Louisiana with the state legislation changes. How is the Sheriff's Office prepared to care for a juvenile in this setting? I know it was done previously, but we moved away from that some years ago. Now we're having to revert back. How is the staff being prepared, and how is the agency being prepared? And then I'll turn it over to Dr. Bidet to answer a little more about how they're serving in that capacity.
Yeah, and first of all, a tremendous response from Wexford about this, getting ready, making sure we have these children medical and mental health records before they come in here. That's huge. That's huge. We don't want to drop the ball on anything. So I'll let Dr. Bidet talk about that. But we have to have people in place who know how to manage children. And it's the same thing with mental health. You have to give your staff the tools to do these things. So they have to recognize in themselves what's wrong, and Onyx is helping us do that. We have training about mental health first aid, crisis intervention training. They have to have the tools to recognize what's going on and then how to treat it. And then in dealing with children, you also have to have people who know how to do that. So you got to understand their brains are not fully developed. You just got to go back to when you were that age. What did you do? You did all kinds of things, right? Because of how your brain was developing. And so far we've seen just gut-wrenching things. Young people who are arrested for trespassing or breaking into a place because they have no place to live. There is no family unit at home to support this 17-year-old. We have a young man who went to do retaliation and revenge because he had been shot and he had been hurt. We've got to get to these children now while we have them here and give them an opportunity. They've got no chance without that family, without that support. And we've got to do something right now when we have them here. And that's why I'm grateful for all our partners in this.
I'll comment a little bit about some juvenile specific programming. And again, as I mentioned in my introduction, this is an area of interest of mine. It's where I started off. It's why I'm still in corrections, is to be able to intervene in a way that is actually hopefully effective in diverting people out of the correctional environment. And so working with the juveniles I'm very excited about it. So we, of course, the number one thing is the assessment and the intake process, in which we will focus on identifying their mental health needs, which are going to be different from adults at times, making sure that the developmental issues, if there's any developmental disabilities, again, the IDD clinic that I mentioned with LSU, this is why this is a super exciting partnership, because we will be able to really hone in on what specific needs in terms of special education or mental health diagnoses, and making sure that these juveniles get the care that they need. In addition to specific programming and clinical modules that Wexford has already developed and is ready to utilize on day one, we'll be able to bring that to the facilities as quickly as possible. In my time talking to the staff that are already there with mental health, I believe they are prepared and ready to go to provide the services that are necessary to keep juveniles, number one, safe. Number two, make sure that they get the interventions and the care and the continuity of care after they hopefully leave the facility. Again, we've got a number of trainings for staff ready to go in terms of trauma prevention, trauma-informed care, and then suicide prevention. Both of those areas are a huge area of focus to ensure that these individuals are safe while they're in our care.
All right. If there are any final thoughts from any of you, I would like to open the floor for anyone to give any closing remarks.
Sure, I don't mind. I could chat about mental health all day. One of the things that I wanted to tag into what Sheriff Hutson and then Dr. Bidet was saying was the importance of recognizing juveniles as juveniles. Our frontal cortex does not fully develop until we're 25 years old. So we're also talking about anyone coming into the jails who is young, not having their full capacity of brain usage, brain space, so on and so forth. And that connects to what Dr. Mitchell was saying about how they fall into addiction. That was connecting with, what Mr. Smothers was saying about how they get addicted to the lifestyle, if you will. And so understanding these processes is so very important. I can't stress it enough. And why I focus on helping people understand certain psychological processes, because it all weaves together to create an ecosystem. And so with all of these partners I see here, I feel very encouraged that, you know, the sheriff's focus on mental health wellness in this system is so very important. And like Dr. Bidet said, very, very unique. And I truly hope it does catch on, that it becomes a mental health ecosystem working across multiple corrections facilities, you know, and hopefully seeing a decrease in recidivism and, you know, making sure that the staff is staying on board, there's less turnover, because you feel safe emotionally as well as physically. So thank you for inviting us to be here. It's been a wonderful experience.
Thank
Just
you
one
all.
more,
Mhm.
just one more comment on the juvenile side. You know, when I was chief medical officer in Indiana for the Department of Correction, we had a large juvenile population, and we found that it was very, very important to screen everybody thoroughly for mental illness, also for addictive diseases. But the other thing that we found was doing training with the staff on parenting and on how to speak to teenagers and so on, because many of them never really had that role model. And so one of the most important things we could do is be role models for them through our behavior and our actions. And when you walked into the juvenile facilities, it was a completely different atmosphere. You didn't hear cuss words. You know, when they had a movie on, it wasn't something with violence. And so they really set a really good example for the students, which I thought was very important.
And Sheriff, I want to let you tell a story about the students at the Travis Hill School, because our deputies who serve in the Travis Hill School, which is one of the top alternative schools and the only school of its kind in a jail setting, really have become like mothers or parents to those who are at that facility. And though they are of an older age, maybe 19 to 24, some of them have shared interesting stories with you about education and how this environment is providing them something they never had.
That's right. That Travis Hill School, which the Orleans Parish School Board allows us to have in here, is a tremendous, tremendous program for us. It gives these youngsters something to do, and they go to school sometimes for the first time regularly. We had a young man who was like, we were like, hey, do you like school better? Is school better inside or outside? And he's like, it's better inside. And we're like, well, why do you say that? He's like, well, I didn't go outside, so I don't know what it was like there. I didn't go. And so now they have this second chance to get that education, which is so key. And we have older folks in our facility who cannot read and write well. And we know that is a hindrance to them in everyday life. But the Travis Hills facility is something really important to us. It's only deputies who want that, who know how to talk to kids, who care about the children, who know how to relate to them. And so they'll tell us things like, you know, they'll go give their graduation speech. They say, I want to thank Deputy so-and-so. You know, she made me get up every day and brush my teeth and wash my face and, you know, all the things you got to drag your kid up every day to do, right? Our deputy is doing that for these kids because they didn't really have that going on the outside. That is right here. It gets you right here. And that is the type of work we're trying to do. So everybody who works with the children has to have that aptitude and feeling for them because they need supervision all day long. And that's what we do for them.
Yeah, that's a beautiful story. I'm going to open it up one more time. If there's any more questions from the media, do you have any questions before we close things out here? All right. Well, this was a beautiful opportunity for us all to come together in this space to share about mental health awareness, especially during this month, and also share about the services and the trailblazing work that's being done right here at Orleans Parish Sheriff's Office, right here in New Orleans. I think, Sheriff, you may not see yourself as a trailblazer, but you are, in the sense of bringing so many services that are needed to this community. And we thank you all for joining us. And we will also go ahead and share this this recording on our social media pages and on YouTube, so you can share it amongst your communities as well. So any last words before we go?
thank you to all our partners. Thank you to you, Casey, for getting this all set up. Jana, this is phenomenal. We got to talk about this more, and this is just the start. So thank you all.
Thank you, Sheriff.
Thank you for the opportunity.
Thank you.
Thank you, Sheriff.
Thank you.
Thank you,
I have-
Sheriff, everyone.
See y'all. Have a great day.
Mhm.